Hello po and good afternoon. I'm Dr. York Bondoc. Our program po is called the Libreng Konsulta. And sa mga nagtatanong po, we're happy to be here today. And sorry po talaga na busy po kami sa amin pong ginagawa. So, nangampanya po kami with Senator Gibo Chodoro. And of course, our Vice Governor, Madam Lilian Nanay Pineda. So we are here today to pick up po yung napakarami po talagang tanong. Parang inuulan po tayo ng mga tanong. And I'd like to instruct po yung maglalagay po ng mga questions. Please use only the first letter or the first name para hindi naman humabulgar kung sino po yung nagtatanong. Okay? So, Reina, are you ready?
Yes po, Dr.
And Kat, I hope you're ready. Okay, thank you. I would like to invite everyone, YouTube po, Dr. York Bondoc, TikTok, TikTok Doc, Dr. York Bondoc. Tara na po, let's start.
From Miss Ruth, good morning, Doc. Tanong ko lang po kung ano pong pwedeng bilhin na gamot para sa anak ko na may ubo. Wala akong pampa-check up. Oregano lang po ang pinapainom ko, Doktor.
Ma'am, I need to know po. Thank you for this question, Ma'am Ruth. And I'm sorry, wala po kayong pampa-check up. But I really need to know po yung age nung anak nyo. Kasi po, how do I put this? Yung ubo, at saka ano po, the treatment is different from a child to a teenager to 25 years old na po, no? So, eto na lang po, no? If this is a child, kung napapansin, one of the things that we often do po is to pampausok po, no? We do pampausok po sa mga bata. But again, kung nakikita pong hirap na huminga, then it's time to go to the doctor. Again, there are public hospitals. Meron po tayong municipal health centers, our rural health units. Doon po kayo magpatingin. If the child is older, you can just, pampausok din po, lots of water, usually it's viral, magre-recover din po. Time to go to the hospital or time to go to the doctor, tumataas po lagnat, humihina po yung pagkain, and nahihirapan pong huminga. So, and I guess it's expensive to go to the doctor, but our government naman po is trying to provide. Okay? Thanks, Ruth.
From Miss Ricky, ano dapat gamot para sa high blood, Doktora?
Well, Sir Ricky, I am very happy to let you know po, no, that there are hundreds of gamots, as in dandami talaga, no? I'll just give you the basics, okay? What is high blood na ngayon? Ano ba ang mataas na 40/90? Pero currently, it has been reduced to 130, lalo na po kung marami kayong risk factors that includes diabetes, advanced age, cardiac disease. Kahit 130 na po, dapat i-monitor na po and possibly maintain na lang po doon or even lower. Okay? Our diastolic, yung systolic po yung sa taas, so 130 yun, especially for those with mga iba sakit. 140 kung walang maraming sakit. Yung sa baba naman po, the lower na this, no? Tooth nyo at yung lahi nyo. Okay. So, lahi blood, everybody's high blood, you're gonna be high blood. Ganun lang yun. Okay? Yun ang kanilang pinamana sa'yo, lalo na kung hindi sila if you are the favorite, you will get the sakit of the high blood. Kumbaga, di ba, pinapamana sa paborito yung sakit, minanap sa iyo yung high blood. Okay, number 2, yung hirap. Putol po ba tayo? Pumataas cholesterol, triglycerides, lahat po yan, that all contributes to cardiac disease, and high blood is an essential component of this. So, lose weight, monitor po yung kinakain nyo, lessen the salt. What is salt? Patis, toyo, and all these pong sobrang pampalasa talaga, no? Yung magic sarap, all of these have salt. So, watch your salt intake. Do not eat chippy, potato chips, chicharon, yun po yun, no added salt. So yun po yun, that's what I can tell you. Know your family history, lose weight, and try to reduce po yung salt and taba ng baboy. Always try to add fruits and vegetables to your diet. With regards to the drugs po, magpa-check up po kayo and your doctor will try you on various drugs. Iba't iba po yun. Depende po, no? Some people will respond better to sitwasyon nila. Okay? So anything higher than 130 over 90, you either need to lose weight or start medication.
From Miss Cheryl, hello Doc, good evening Doc. Pwede ask ko, ano po ang inumin para sa makati ang lalamunan? Pagkatapos mauubo, ako wala namang plemang lumalabas.
Cheryl, number 1 question ngayon sa mga kumakati ang lalamunan, ha? Pag nagkakaroon na ng kumakati muna yung lalamunan, day 2 mataas na yung lagnat, day 3 wala nang naaamoy, be careful that could be the start of COVID. Pero sa hindi daw siya inuubo, no? Baka naman po it's just a virus. But again, kung naglalala po, no, it's time to think about COVID.
Okay, next question.
Next question po.
From Miss Benny. Hello ma'am, good day. Magpapakonsulta po sana ako tungkol sa ubo ko na halos 3 taon na po siyang daladala ko. 2 beses po ako nagpa-x-ray, clear naman po. Ngayon po, dumadanas na po ako ng sakit sa
Pakiulit
likod.
lang, I'm sorry, naputol. I'm sorry. To interrupt. Can you read it again po?
Okay, from Miss or Mr. Benny. Hello ma'am, good day. Magpakonsulta po sana ako tungkol sa ubo ko na halos 3 taon na po siyang daladala ko. 2 beses po ako nagpa-x-ray, clear naman po. Ngayon po, dumadanas na po ako ng sakit sa likod sa may kaliwang lungs. Para pong may pasan ako lagi. Padidibdib ko masakit na din po. Nahihirapan na po ako.
This does not sound good, sir. You need another x-ray. Hindi nyo po binanggit when you got x-ray. Baka matagal na po. The first thing that I would start po dito is to do an x-ray, okay? Number 2, kayo po ba ay naninigarilyo? I would advise you to stop smoking immediately. And then number 3 po, we'll go from there. Ang hirap pong sabihin why you're coughing. We could be looking into asthma. If you're a long-term smoker, COPD, emphysema po. And then, kung talagang long-term smoker, of course, we always have to watch out for lung cancer and possibly tuberculosis. So, yun po yung mga reasons. That is the workup po for 3 years. Again, we also need to look into your medications. Some high blood medications can cause cough. And also, we need to look po into GERD or gastroesophageal reflux disease. Lalo na pain and coughing. Napapagkamalan po yan na heart attack. So, of course, we need to check up your heart, kasi baka naman may problema na rin yung puso. But a lot of the combinations of cough and pain sometimes look into acid reflux. Okay?
From Miss L, good evening, Doc. Gusto ko pong malaman kung bakit laging masakit ang ankle ko po pag naglalakad ako.
Ma'am Ella, my question to you, how old are you? Okay? And very good question number 2 is, what is your weight? Okay, bakit? Diyos ko, bakit pinakikalaman ni ma'am yung kinakain ko at yung aking timbang? Well, one of the main problems po, no, and this is really happening po, yung degenerative diseases. If you're older and you're overweight, dyan ho nangyayari yung mga ano po, knee replacement, hip replacement. Baka ho, there's a lot of weight. It will really help somebody yung masakit ang tuhod, masakit ang balakang, masakit po ang bukong-bukong or ankles to lose a lot of weight. At least kung talagang babigat ko kayo, bawasan nyo po yun, no? And then after that, kung talagang payat naman po kayo, your ankle still hurts, titingnan po natin na mamaga pa po ba siya. Kasi pain with inflammation equals rheumatic diseases po. No? We need to look at diseases of the bones and the joints. So yun po yung titingnan natin. Kung may edad naman po kayo, baka naman ho arthritis lang. Okay? But again, if it persists, you need to go to your doctor.
From Miss Lamery. Hello po. Paano po ba magpapayat?
Ay nako, pag nalaman mo yon, Miss Lay Marie, sabihin mo sa amin. Di ba, Rains? And di ba, Kat? Okay, next question. Hindi rin namin alam. Watch what you're eating. Ang weight loss talaga, what comes in, dapat yung ano, kung mas marami po talaga pumapasok kaysa sa ginagamit ng katawan, tataba po talaga tayo. And unfortunately, it is familial also. It's a hereditary rin po.
Ma'am, ask ko lang po, ilang buwan po kailangan magpahinga ang operado sa bato, sa abdo? Magsasaka po kasi ako.
How long po kayo magpapahinga? It also depends po on the person, ano? Meron pong mga tao, like, some people recover faster than others. It depends po talaga kung meron, ano pa yung mga ibang sakit nyo and your age. If you are very young, wala po, very healthy, mabilis lang po yung recovery. Ngayon kayo po ay senior, diabetic, high blood, dahil sabihin na natin lahat ng sakit, mas mabagal po yung recovery. So what I would suggest po sa inyo is, in the US po, people who are operated on, they walk very quickly. Dito sa Pilipinas, we tend to baby our patients eh. I would say po, kung malakas po yung katawan nyo, within a week, you can start to do stuff. But again, i-consult nyo po muna din, of course, sa surgeon nyo. Okay? And again, ito, sa abdo ba yung problema niya? Ito lang, I just wanted to say this. Nauso na po yung laparoscopic surgery, no? Maliliit na butas po yun sa tiyan to take out the gallbladder. We do that now because yung recovery time po nun, days. O 1 day, ganun ho, pwede na kayong umuwi. Samantalang yung traditional operation, yung bibiyakin po yung tiyan sa gitna to take out the gallbladder, araw po, and talagang it will take time for you to get better. So it also depends on the kind of operation po na naganap po sa inyo. Okay? Thank you.
From Miss Salenga Constant. Good afternoon po. Tanong ko lang po, yung brother ko po meron COPD. Okay po ba nabilihan ko siya ng oxygen concentrator? Para po pag nahirapan siyang huminga, yun na lang po ang gagamitin niya.
Ma'am, it depends on the type of COPD po that your husband has. There are some COPDs po, especially po yung there are some COPDs or what is COPD? Chronic obstructive pulmonary disease. Yun po yung sakit na dulot po ng paninigarilyo. 2 kinds, emphysema and chronic bronchitis. Okay? Oxygen sa mga taon to is controlled well. No? It has to be prescribed by the doctor kasi there's a point na hindi rin maganda yung sobrang daming oxygen. So, I would suggest po to consult with your pulmonologist muna. Do not buy an oxygen concentrator on your own. Pa-reseta po kayo sa doktor. And for those who are smoking, I'd like the end stages po of chronic obstructive lung disease, naka-oxygen na po 24 hours yung mga tao dahil hindi sila makahinga. Ang sama po talaga ng pakiramdam na yon. So if you're smoking, please listen to this. Okay?
From Messenger. Good AM, Doktora. Please hide my identity. Doktora, ask ko lang po. Pwede po bang magpa-vaccine yung may asthma?
Yes, thanks for this question and thank you na nagkalakas loob po kayo even if you have to hide your identity. Yes, kailangan po. Yes, people with asthma and other lung diseases are not only allowed to be vaccinated but recommended po, strongly recommended. Kasi po, biro mo, mas na nga itsura ng baga mo, nahirapan ka na, naka-oxygen ka pa din, patungan pa natin ng COVID. Parang plus yun eh, it's a plus factor. At hindi siya plus factor na maganda, plus factor po siya na masama, na mapupunta kayo sa ICU and then possibly high risk of death. So yes po, please, magpabakuna po kayo. Kung nininervous po kayo na todo, get a clearance from your doctor. Sa mga vaccination site po, may mga doktor naman so they can help you. Okay?
From Messenger, good AM, Doktora. Tapos na po ito, Miss Kat. Next po. Teka po, mukhang nawala si Miss Kat. Ayan. From Miss Doc, pwede po bang magpabakuna ang may fatty liver? Yung sa friend ko kasi na may fatty liver, di siya inalaw ng doktor niya.
Mali po yun. Unless there is another reason po na hindi po natin alam, ano? But all liver diseases, cirrhosis, hepatitis, fatty liver, liver cancer, dapat po bakunahan. Kasi again, plus factor po yun. May sakit na po kayo sa atay, tapos nagka-COVID po kayo, talaga pong mas malaki po yung chance nyo na maging seryoso po yung inyong COVID. And I'd like to say, we were guested by Dr. Janus Ong, one of the top hepatologists po sa Pilipinas and the Yellow Warrior Society, yung mga may sakit po ng hepatitis. And pareho po yung message nila, you need to be vaccinated.
Ayan, from Mr. I think tapos na po ito, Doktora. Ay, hindi, sorry, from Mr. Sean. Good afternoon po, Doc. Ang asawa ko po madaling hingalin. Naninikip agad ang dibdib niya. Nahihirapan pong huminga. Ano po ang gamot ang pwedeng inumin niya? Salamat po.
Hindi po natin, thank you for this question and thanks for being so a concerned husband po, no? Hingalin, nahirapan huminga. There are two main causes, heart or lungs. So, ipa-work up nyo po muna si mommy or si Mrs. Tingnan po natin yung estado ng kanyang puso. What should we do? EKG, blood pressure, diabetic po ba siya? And then we will go from there kung may mga changes. Kung na-clear po si heart, puntahan naman po natin si lungs. Chest x-ray po, then malalaman po natin yung pulmonary history ni ma'am, may asthma ba siya, naninigarilyo ba si ma'am, does she have COPD. Pag nasagot po natin lahat yung mga tanong na yon, then we can decide on the gamots. And then thirdly, kung wala pong makita doon, there is also the component po of anxiety and panic attack. So, kailangan din pong pag-aralan yon. So, once we go through that, decide po natin, is it coming from the heart? Is it coming from the lungs? Or panic attack po ba ito, which can look like a heart attack, ha? So, yun po yun. That's the workup that I would do for a lady po na hinihingal, nahirapan huminga. We really need to check these two vital organs and later on, mental health. Okay?
Okay, from Miss Keza. Magtatanong lang po ako, Doc, kung pwede po ba akong magpabakuna? May allergy po kasi ako sa loob po. Allergy sa loob daw, Doktora.
Ano po yung meaning ng allergies sa loob? Oh, sorry, there's a naughty 9-year-old waving his hands. So, pasyensya na po, no? Sorry, I am not familiar with the term allergies sa loob. Meron bang, I'm sorry, Reina, as a nurse, na-encounter mo ba ito?
This is the first time na na-encounter ko to, Doktora. Maybe okay. She's saying na mga parang allergy na, I don't know, I'm not sure.
Hindi, ganito na lang, ma'am. We're still here for a while, no? So, kung gusto niyo pong dagdagan yung para maintindihan po natin. Pero I'll just give a general story about allergy po, no? At saka po COVID vaccines. And some of my classmates are allergologists. Yung hindi po dapat magpabakuna sa COVID, yung may allergy sa mga components po ng bakuna. But that is really, rare, okay? So, halimbawa, allergy sa pagkain, allergy sa shrimps, and allergy sa pollen. Um, Hindi po yun grounds for disqualification. Pwede pong mabakunahan yung mga yon. What should you do? Kung may doktor po kayo sa allergy, magpatingin kayo, pa-clear. And again, do not worry po, no? Kasi after the vaccine, you will stay there talaga. 15 to 30 minutes. Kung ayaw nyo pang umuwi, pwede kayo mag 2 hours doon. Okay? Wala naman magpapaalis sa inyo. And you will be thoroughly checked po for blood pressure, kung ano pong nararamdaman, kung namamantal, ganon. So, meron naman ho talagang safety checks. Okay? But again, if you would like to add more info on the question para po masagot po namin na mabuti, please do so. Thank you again. So, yung mga may allergies, please. Rare po talaga yung allergy doon sa bakuna components. But if you're nervous, get yourself cleared. And then, don't worry, you will be watched for 15 minutes and more. Okay, ito pa, tip. Sa mga may allergies, ang dapat yung bakuna is Sinovac. Kasi po, ang Sinovac is the one with the least side effects and the least allergenic. Okay? Maraming allergy, pag-isipan mo ang Sinovac.
Okay, next question po from Mr. Chris or Miss Chris. Hello, Doktora. Good morning. Meron kasi akong anak na may asthma. Pwede kaya siyang pabakunahan?
Yes, yes. Yes, Chris, thank you. I don't know how old your anak is, 12 and above, pwede na po. If they have asthma, even better. And again, if you are nervous, get a clearance po from your doctor. Ay, ito lang kung talagang na-asthma attack yung tao, huwag niyong dalhin sa vaccine site, no? Ipakalma ho muna yung asthma attack. Like talagang hinihingal, ubo, that is not the time to go to the vaccine site. Upawin kayo, okay? So, if you nebulize. If you take steroids, take your gamots until your asthma is calm, and then you go to the vaccine center. Okay?
Okay, from Miss or Mr. Richel. Good day po. Yung asawa ko po kasi schedule niya ng second dose last November 12. Pero sa kasamaang palad, naiwan ng mga vaccinator yung gamot sa bayan. Kaya yung ginawa nila yung gamot para sa first dose, yun ang itinurok pang second dose. Pwede po ba yun? Wala po bang masamang epekto sa mga nabakunahan? Salamat po.
Yes, this is a very interesting question. Wag po kayong mag-alala, no? The first dose is the same as the second dose for all vaccines except 2 vaccines, okay? So si Pfizer, yung first dose ng Pfizer is the same as the second dose. And the Moderna first and second is the same. Sinovac first and second is the same. But the Astra, different po si first dose at different po si second dose. So, pero parang mahumina na yung Astra, so I'm suspecting hindi po Astra yun eh. And then, of course, for Johnson & Johnson or the J vaccines, 1 dose lang po yun. Okay? So, don't worry po, no? Unless it was Astra, at kung recently lang ho yun, wala nang masyadong Astrang binibigay, it's mostly Sinovac, Moderna, and Pfizer, don't worry, okay lang po yun. Okay? Thanks for that very nice question.
From Ms. Mavic Olog, Doc, ano po ba ang cause nung bigla na lang nangangati ang lalamunan tas uubuhin? Yung parang daming plema sa dibdib na namakapit. Hindi mailabas ng x-ray naman po ako at clear naman kapag uminom po ako ng cetirizine nawawala. Ang age ko po ay 32 years old po. May time po madalas akong atakihin nung ganong ubo. Negative naman po ako sa COVID.
That is good. Thank you. Oh, ang ganda ng question niya, kompleto. I'm very happy that you're negative sa COVID. Bata ka pa. Cetirizine, that sounds like allergic rhinitis. Try to find out po kung what are you allergic. May aso kayo, goodbye na sa dog or cat, okay? It sounds like allergic rhinitis, lalo na po since the gamot is cetirizine, So do take it. Kasi kung minsan yung mga may allergic rhinitis, they take lang and then they stop. Matagalan po it takes a certain time para bumaba po talaga yung allergy level nyo from allergic rhinitis. Okay? If it is not allergic rhinitis, of course, pa-work up po, there are other reasons kung ba't biglang inuubo. GERD, again, as I mentioned, gastroesophageal reflux disease. Mga gamot po can also cause coughing. Okay, but from the sound of it, it looks like Allergic rhinitis. Okay, thank you so much.
Naku, mahabang question po ito from Mr. Shan or Miss Shan. Hello po, may I ask lang po ako. Kasi po may dalawa po akong pasyente kaninang mag-ama. Ayon sa Batasan Hospital, suspect po ng dengue kasi po yung isa 134 po ang blood platelet. Then po yung isa 101. Binigyan din po ng referral kasi wala na pong space sa Batasan. Then tinulungan ko po silang pumunta sa JBL. Then nag-fill up po sila ng form and then chine-check up and in-x-ray at test sa blood. Then pinauuwi na lang daw po kasi wala naman po masyadong sintomas. Dapat daw dumugo na yung ilong at nagsuka, mataas ang lagnat bago daw po I think this is bago daw po i-confine.
Hindi po, no? You mean ayaw nila i-confine? What's the question? Sorry, I got the point that the two persons are suspect dengue. Kasi mababa po yung kanilang platelets. Tama ba ako?
Yes, Doctor, I didn't get the questions also kasi
Pero I read something na dapat dumudugo. Hindi po, no? I've seen people with platelets of 0. Hindi sila dumudugo. I've seen people naman with platelets more than 0. Posible rin ho silang dumugo. So, hindi po siya automatic na dahil 100 yung platelets, so dudugo po kayo. I failed to get the question. Ano po yung tanong?
Yes, sana sumagot po si sir or si ma'am.
Did you get, I'm sorry, did I understand the question or mali ba yung sagot ko or
no,
what?
Doctor,
Anong tanong?
I didn't
Tama
get
ba? May dalawang tao, suspect dengue, mababa yung platelets. They went to the hospital. Tama? And then he's asking, bakit hindi sila nagbi-bleed? Tama ba ako?
Yeah, parang ganun po. He is stating the state of yung status po ng patient. And plus, wala po
ito lang Opo. Just because the platelets are 130 and 134, hindi po automatic na bleeding na yun sa harap ng mo, no? As I mentioned nga, I've seen lower platelets. Should they be admitted? It depends po, no? And baka naman ayaw nila magpa-admit. That's another issue. Pwede naman pong ma-admit. Halimbawa po, mataas po yung lagnat nila. They are dengue positive. Mababa pa ho yung platelets. No? Baka naman pwede munang i-observe and then kung dapat pong i-admit. Okay? So if you want us to answer more details po about the question, please ilagay nyo lang po. Sasagutin po namin yun.
I think the way I understand the question is this, Doktora. Parang he or she is stating, the patient is stating na sinabihan sila, nung lumipat sila sa JBL, did all the x-ray and test, laboratory, etc. Bigla na lang daw silang, hindi naman bigla, or in-advise silang pinapauwiin na lang because wala po yung mga simptomas such as pagdudugo ng ilong, swelling of the whatever it is. Yes. So, pinauwi na lang po sila at hindi na daw in-advise sila na hindi kailangang i-confine. Just, if ever lumabas yung mga ganitong mga symptoms like magdugo ang ilong, swelling of the tummy or whatever, or pinhole, red marks on the whole body, I think that's the time
bumalik lang. Okay. I got it. Okay. Thank you so much for that explanation. Ganito po yun, ano. Ang dengue po talaga walang gamot. So the hospital will not give any secret gamots po to the patient, no? Yung pinsan ko use tawa-tawa eh. Pero the reason that we put people in the hospital is kung sobrang baba po talaga ng platelets nila, worse, they start to bleed, they might need transfusion po ng platelets. And then number 2 po, yung siniswero po sila kung talagang hindi po makakain, sobrang taas po ng lagnat, ganun po. But actually, dengue can be managed at home. Pero ito na lang advice ko. Kung nakikita nyo pong grabe yung pasyente, bumalik po kayo sa JBL and request to be admitted. Yun po.
Hooray! Okay. Sana po, nalinawan po, This is from Miss Lorena.
Yes, and wait lang dun sa balikan natin yung dengue. Just because pinauwi po kayo, ang importante po, i-monitor nyo yung pasyente nyo. Kung gumagrabe, balik po sa ospital. Okay?
And just to give a piece of, parang ma-reassure kayo, yung patient natin, doktora, hindi po kayo papauwiin ng doktor or ng mga nurse or any medical practitioner
Oo
Ilang
naman, kung
ganun-ganun lang.
unsafe,
Oo.
oo.
Yes.
Pero
So,
again, the situation can change. So,
yes.
monitoring pa rin po. And
Yes.
kung ninenervyos kayo, you think it's not going well, karapatan nyo pong bumalik.
Tama po. Just ano lang po kayo, relax lang. As parating sinasabi ni Doktora, relax. Pero do your job, like monitor it. Yan.
Tsaka tanongin nyo, gumagrabe ho ba? How do you feel? Ganun po. You can
Yes.
also have platelets taken po from an outside laboratory. Pwede naman hong pumunta doon sa bahay ng pasyente. Ano po?
Yes. All right. Another question from Miss Lorraine Yambao. Hi, okay lang po ba na magpabakuna ang mayroong menstruation period? I think
Yes, ma'am. Pwede po. There is no relationship
from Mr.
between
Henry.
bakuna and mens. Wala po. Okay?
Okay. All right. From Mr. Henry Oliquino. Hello po, Doktora Ana. How healthy and effective is Ensure milk? And its different flavoring like vanilla, coffee, regular. And now, meron na pong ready-to-drink na sterilized Ensure drink. And is the sugar content of it? Thanks po, Doktora Ana.
Ay, Sir Henry, ito po, no, if the person, I don't know if that's you, your mom, kasi my mommy had cancer and took Ensure. We normally give Ensure po to persons na talagang not eating. Usually the elderly, those undergoing cancer treatment, ganun po, yung talagang nagwe-waste away, we give them Ensure, ano? But again, tama po yung tanong nyo because you have to be conscious. Mataas din po sugar content. There is a drink for diabetics, ang Glucerna po, ano? But, ito po yung philosophy ko sa buhay. If you can eat naman po, masarap ang ulam nyo, may ganas kayong kumain, I still believe that the best nutrition po is sa pagkain. In fact, hindi rin nga ako excited masyado sa mga supplements and vitamins. So I do believe po na if you can eat well, then get your sustansya from the food. Pero kung talaga naman pong like my mom, cancer, no, then we need to give Ensure. Okay?
From Miss Hilda Yabut, Dok, sa mga barangay po, may MTRD vaccine sa mga bata. Ilang weeks po ba pwedeng magpabakunahan ng MTRD? If halimbawa, mas nauna munang bakuna laban sa COVID. Kumbaga, after ma-fully vaccinated muna po before magbakuna ng MTRD. Hello, Doktora?
Ano po yung, ma'am, I'm sorry, I am not a pediatrician. Opo. Ano ba yung MTRB? Diyos ko, hindi ako,
I think this is the
hi,
measles,
malinaw ba?
Doktora. Pang measles po yata to. I'm not so sure, ha? Yeah.
I'm not a pedia, ma'am. Apologies. Apologies.
Okay, next po tayo. From Miss Karen Reyes. I think this is the last question that we have for today, Doktora. From Miss Karen Reyes Sena. Hello po, Doktora. Ask ko po kung pwede nang magpa-inject para sa COVID vaccine.
There are hundreds of questions. Sandali lang. Ako muna. There are hundreds of questions on the messenger. Paki-pick up lang. Opo. As in, inuulan talaga. Pero most of the people naman are asking kung pwedeng magpa-consult eh.
Yeah. Okay po.
Anyway, it's okay to stop now kasi ano na rin.
From Miss Karen Reyes Sena. Hello po, Doktora. Ask ko lang po kung pwede na magpa-inject para sa COVID vaccine ng anak ko. Kagagaling lang po niya sa dengue, 5 days po siya na-admit sa JDL. Na-discharge na po siya nung Saturday.
How old is the child? I'm presuming older than 12, ano? Ma'am Karen, what I can tell you is recover muna from the dengue. Kumakain na ba si anak? Tumatakbo na? May gana na ba? Does he feel well? And then magpalipas ng a few days and then pwede na rin pong magpabakuna. Kung talagang hindi pa po strong, don't force it. Kasi that child should just remain at home safe naman. I'm hoping bakunado rin naman kayo lahat sa bahay. Ano po. And sa bahay din naman yung bata kasi still recovering. So, you wait lang po until kumakain, naglalaro na, doing all sorts of things, and then we can talk about bakuna. So, sa inyo po lahat, again, bumababa po yung mga cases natin, but that doesn't mean na tapos na po yung ating pandemic. We still need to remain very cautious. We need to wear masks. tinanggal na po yung face shield, but you can still wear face shield po. And of course, social distancing. Be very careful po when we eat with people na hindi po natin kasama sa bahay. So sa inyo po lahat, thanks so much and good evening.